Welcome to BrainTalk, a podcast from Project BrainStorm about the bipolar spectrum. Your hosts are Dr. Jim Phelps, a psychiatrist and author of several groundbreaking books about bipolar, and Sara Schley, author of the memoir Brainstorm, From Broken to Blessed on the Bipolar Spectrum, and co-creator of Brainstorm the Film, coming to you in 2025. Here on BrainTalk, we'll interview new experts each week about their research and expertise within bipolar, and listeners will call in to ask questions. Let's work together to save lives, end the stigma, and create healing for everyone on the bipolar spectrum and those who love them.
Hey there, Dr. Phelps, what's happening?
Hello, Sara Schley. Nice to see you once again. We're going to talk today to someone from my alma mater, Stanford University. So this is an opportunity for me to go home a little bit.
Dr. Shebani Sethi is coming up, and her work is really interesting because people are always fascinated when we hear about keto. And she is very much dedicated to the keto diet. We'll talk more with her about this. She refers to herself, I believe, as a metabolic psychiatrist, which is a different way of looking at this whole elephant, the entirety of the elephant of what's causing bipolarity. Is this about, brain energy and that kind of thing? What are your thoughts on keto, Jim?
I think you stay in my business long enough, you become like a professional skeptic.
Yeah.
So there are lots of exciting new treatments popping up and cool, but let's see how they really prove out. There are some risks that go with it, but probably not as many risks as a brand new pharmaceutical that we don't know anything about. We know a lot about ketogenic diets. They've been around for a long time.
It's interesting, whenever I talk about what we've been learning on the road, filming for Brainstorm the Film and various possible treatments, people always perk up when they hear about a diet because they think, oh, that's something I could do myself, without a prescription. We'll find out more. All right, well, let's welcome Dr. Shebani Sethi to BrainTalk. Dr. Shebani Sethi, welcome to BrainTalk. We're so glad to have you with us. It's been a year since I saw you last, and you were deep into your work on keto diet and metabolic psychiatry and how that's working with people with bipolar disorder. So we're really excited to catch up with you and everything you've been doing. But why don't we just start by saying, how did you get interested in this field?
Yeah, that's a great question. So in medical school, I had some experience with doing an obesity medicine rotation. And in that experience, I saw patients that had mental health conditions as well. And so I ended up asking myself, well, how is this connected to obesity? How is this connected to metabolic health? And oftentimes when I was in a primary care setting, I saw patients complaining about blood sugar issues, or they're pre-diabetic or on their way to have diabetes. And they also had mood symptoms. And so that wasn't always addressed. Maybe there was a referral to a psychiatrist, but it just seemed so siloed, psychiatry in one place and primary care, endocrinology in such a different area that just didn't feel connected enough for me. And I wondered whether there was a relationship between the two. And that's how my interest started at that point in training. So when I went through residency, I focused on the metabolism and mental health and what we know as metabolic psychiatry today.
Wow, it's really fascinating. I always love when somebody sees silos and says, okay, we need to figure out the interdependency between those two, or what's the connection.
And the gap in care that I noticed was, those with serious mental illness have much, much higher rates of metabolic issues. The percent of those who are overweight or obesity are much higher than the general population. A lot of these patients actually don't necessarily have a primary care doctor. And, they're taking medications which are also life-saving, but at the same time have some side effects as well. I felt it was just really important to address that and not dismiss it or ignore it. And so that's why I ended up getting boarded in obesity medicine as well as psychiatry.
And so what is metabolic psychiatry? Am I right that you coined that term, or did I make that up?
So when I was in residency training, I had created a pathway for myself, actually, and other residents for the future at Stanford who are training here at Stanford. And it is a eating disorders, obesity pathway originally, and then I started also realizing that this connection is through many different diseases within psychiatry. And so I termed it metabolic psychiatry because I felt that metabolic interventions can be helpful for psychiatry as a whole. And bringing a name to it has brought a lot of attention to put further research in it. And now I'm primarily focused on research at Stanford, focused on different interventions. So ketogenic diet is one of those interventions, but also I've looked at obesity medications and other insulin sensitizers that also target different parts of the brain, essentially, that can be helpful for mental health outcomes.
Shebani, so metabolic interventions, I imagine there are a number. I know that you've focused quite a bit on ketogenic diet, and our work, as you know, in this podcast and the film is focusing mostly on bipolar spectrum, mood spectrum challenges. What is a ketogenic diet? And then we'll ask you more about why is it useful and how does it work?
Yeah, all great questions. Yeah, so a ketogenic diet is essentially a eating pattern that is a low carbohydrate, moderate protein, and high fat diet. It is a dietary pattern and has been a metabolic therapy for epilepsy. I had, through my obesity medicine experience and training in the past, seen that it improved insulin resistance and obesity as well. And so when I had originally saw patients with bipolar or with schizophrenia through my training, they were struggling with metabolic syndrome or they were struggling with other metabolic issues. And I figured, well, if it's helping for other brain conditions, the ketogenic diet for epilepsy, and we have these medications that have side effects, could it be helpful for either? I did a pilot study which looked at 23 individuals with a ketogenic diet in schizophrenia or bipolar. And we looked at psychiatric outcomes as well as metabolic outcomes. So with bipolar, we did see 79% had an improvement by at least. Yeah, some said that it changed their life. Some said that they were able to get off disability, start working again. And it was largely due to a mental clarity they felt they had, even if with hallucinations or with delusions, the frequency was less. So even if they still had the symptoms, there was some tangible improvement that they felt. Or their family would report that maybe they didn't necessarily notice, but their family did. Why does it work with bipolar? Most honest answer is we don't really know exactly, but we do know some things about the brain and what ketogenic diets do. Insulin and glucose handling in the brain is a bit different when you're diagnosed with something like bipolar or with schizophrenia. There are handling differences even before you start someone on a medication. There are changes in those areas for these conditions. And so if you have a metabolic treatment that's going to circumvent that pathway, if there's a deficiency in a certain pathway and you circumvent that pathway to create energy, that's the idea behind a ketogenic diet, is that you're finding a different pathway to create energy when your brain didn't really have the energy to begin with, or it didn't have all the pieces together in the machinery that are needed.
So your car can run on two different fuels. It can run on gasoline and it can run on electricity. But some people's gas engine is just not working that well, and so their engine is kind of sputtering and they can't make the car go very fast. And for them, if you can just push the engine to switch over to using electricity, then the car, it can function the way it's supposed to. Is that switching in fuel, is that fair?
Yeah, that's fair. I really like that analogy as well. And it's it's exactly right. The idea of your body going from a primary carbohydrate burning state to a fat burning state. You're producing ketone bodies that gets in the blood from breaking down fat, and then we measure that in the blood. And so in the trial, we continually measured the BHB level, and that's how we knew whether they were compliant to the diet or not. I know it's a pilot study, and we would need more data to kind of conclude or confirm that, but we are working on designing an RCT study right now, a larger one of 120 folks, looking at control versus a ketogenic arm. Yeah.
And your dose response relationship was the more ketogenic you are, the more period of time that you stay in that state, the better your symptom response.
Yeah, exactly.
Could you give us an example of, well, what kinds of things are people eating when they're pursuing the ketogenic diet?
Yeah, so for example, maybe for breakfast, they'll have eggs and they'll have an avocado. Could be smoked salmon in the morning with eggs and some cream cheese, and it's actually what I eat in the morning. So I'm just kind of describing my own breakfast. So yeah, that's a keto-friendly breakfast. It could be like a chicken salad or fish and vegetables, and the same thing for dinner. It could be meat, some poultry and some vegetables. And the vegetables are just very carefully picked out that they are non-starchy vegetables versus starchy vegetables. So, I provide them a list of what the differences are, and then kind of a, meal plan to try to understand that.
We did some filming of some of your colleagues over across the pond in Scotland, too, keto, people who swear that it changed their life completely from devastating bipolar depressions for decades, and now they're back. And so it's pretty anecdotally really impressive to hear these folks. So we did like a little cooking thing with them, like a British Bake Off. They were in the kitchen and they didn't know each other, and they're sharing recipes. And so he makes us like onions and mushrooms and butter and steak, and then they had like whipped cream and berries. This looks pretty good.
Yeah, you can.
Yeah. So,
yeah, you can have dessert. It's just a different kind of dessert.
The ketogenic diet, as I understood it, is used in kids with epilepsy. That was one of the places where it was first really pursued, was in epilepsy that was not responding to typical anti-seizure medications. This diet really worked, but then you have this challenge of parents and children and who's in charge. And so the good news is, man, if parents and children can do this and get a response, I'm presuming somewhat easier for working with adults?
Oh, absolutely. I mean, the more support one individual can get, the better. And I have found, parents often kind of reach out and they want their, kid to have this treatment. And so it's really important to engage sometimes the family together. It's helpful, especially as they're eating meals together, right? And so which is why as part of our clinical program, we're doing support groups. So for any patient, their, any caregiver, parent or family member, or if it's their, girlfriend or boyfriend, they can come in and support them. And that's been helpful for patients to feel like they're not alone.
I would think that from my standpoint as, during a bipolar depression, I can't even figure out how to open a can of soup, let alone shop and cook a more complex diet. I think there's also craving for carbohydrates, but it's so difficult to do anything. I would think it would be really important at the beginning, until you start to have positive response, to have a partner, spouse, mom, dad, kid, somebody who's actually helping you implement this diet. What do you think?
Absolutely. It's so critical. There's obviously a selection bias in sometimes who comes to me because they're so motivated and they want to start right away. But then there are the ones that, exactly what you're talking about, Sarah, that do need that support initially. And so we want to provide that as much as possible because we want them to succeed. And I know we focus on ketogenic diet right now because that's the most recent trial and the next trial that I'm currently working on. But there are other metabolic interventions, medications that can be helpful too. And so I really try to figure out what's the most, in a personalized way, what's going to be most helpful for, that patient. So for example, with cravings, there are some people that are just a bit more biologically wired to have a little more trouble with that, and have withdrawal symptoms, even just getting off sugar. It really does happen. And so having a treatment approach that considers that can be really helpful too, even with medication, like food cravings and so forth, to help them with that.
Yeah, I wonder, and correct me again with my analogy, if someone's brain is just saying, come on, get us more fuel, it's thinking, get me more glucose, because glucose is not working, so carbohydrate craving is like, get me more gasoline. So the irony is, getting you more gasoline is not going to work. Your gasoline ingestion system is not working. We need to switch you to electricity.
Yeah, exactly.
EV,
I love that.
You have an electric vehicle.
Yeah.
And a hybrid. Shebani, can I go back to something you said earlier about mental clarity? Because I find that really interesting, because one of the things I've talked to Jim about and others is this dramatic decrease in cognitive function that people like me experience when we're having a depressive episode. Like, it's like, what happened to my brain? And it's hard. I haven't heard really good explanations, but so can you correlate why is the keto diet or the ketogenesis or the electric fuel and Jim's metaphor analogy, how would that help me with my mental clarity or cognitive function?
The idea with the dietary changes and what it's doing in the brain is that it's actually changing the structure and function of the brain, over time. So with imaging studies, the idea is that there's actually more connections being formed. So you have improvements in synapse, changes, neuronal proliferation and growth. And so that's huge, right? To have something like a diet changing that.
Wow.
Now, if we think about drugs or medications, making changes in that area, I don't know much about that. I don't know how much that actually changes structure and function of the brain. Dr. Phelps, maybe you have some thoughts on that, but I think there are probably some changes, but how much is a different story, right? There may be more functional connectivity changes that I've seen, but...
Right, yeah. So lithium would be the famous one. Lithium's ability to promote neurogenesis, to help neurons grow, new neurons, make more connections, just as you were describing for the results of the diet that's been seen with lithium. I think it's actually pretty substantial. As you probably know, there's interest in looking at lithium as a preventive agent for dementia, because if lithium can help neurons grow and survive, maybe it can help them withstand the things that take us toward dementia. But to be able to do that with a diet without, and actually see those same kinds of neurogenesis in the brain with a dietary change, that's really exciting. And Shebani, you mentioned it's not just a ketogenic diet. You have numerous interventions. Could you tell us about some of the others?
Yeah, so I do use a lot of insulin sensitizers. There's more studies coming out looking at psychiatric outcomes with GLP-1s. And then there are medications like, for example, naltrexone and bupropion, which are commonly used in psychiatry, but also is a repurposed obesity drug called Contrave. Zonisamide is another one. There are different medications that act on, either the
different ways
reward pathway or other areas that's going to affect appetite regulation centers and so forth that are helpful in this particular context as well. So it's a mix.
In terms of
combine it with nutrition. And also combining it with nutrition as well.
I have a daughter who's in her 20s. I'm also an American woman. There's so much focus on our bodies, body image, and a concern about people getting overly obsessed, let's say, with a particular diet pattern, particularly if it's a rigid one. And I think with, I know for myself, like, it's not helpful to get too extreme about things, if that makes sense. Because when I was younger, I could get like, oh, I'm going to do this diet or this exercise or this, and it would like send me off into not the greatest place. How would you deal with body image issues, eating disorder, disordered eating challenges while prescribing a ketogenic diet, let's say?
Yeah, no, I think that the question that you're getting at really is important. And I think patients with those types of issues do need more of a nuanced approach. I do really worry about kind of too strict and thinking, kind of overthinking, and the rigidity of that. So if there's too much rigidity, and I notice that I'm very sensitive to that, and I increase the flexibility, and I don't put rules as much with them, and really just focus on what the goal is for them health-wise, and then just try to get there. And it doesn't have to be like a rigid plan like that. It's a very different approach. I did actually so I've been trained in eating disorders, so I do DBT therapy or CBT with them. And DBT is dialectical behavioral therapy, which can be really helpful for emotional dysregulation, and especially when it comes to food consumption as well, it's very relevant.
Well, Dr. Sethi, we're going to need to wrap, and we know we want to honor your time because you're a busy Stanford researcher and professor. What would you like to share with us? Anything regarding a message of hope for those of us living with bipolar in our families? What do you see on the horizon? What are you hopeful about?
Yeah, I want to say that anyone who's listening, that there are factors that are available that you are able to control. If you are suffering from bipolar or schizophrenia, that maybe you haven't tried, and it's worth giving it a shot. And if it is something that you are interested in or have questions about, we're more than happy to triage you, whether you want to be involved in a clinical trial or whether you want clinical care or you just want resources. We're happy to support that. MetabolicPsychiatry.com is a good place to start, to go and to contact us. So we're happy to be there for you. Or if you're a provider or a clinician that's interested and you want to understand more how you could integrate this in your practice and want us to support you, we're happy to do that as well. Please reach out. Metabolic Psychiatry Labs is the other website. So we have 2 websites, and happy to support. Thank you for having me on your show.
Wow. All right. Well, wonderful. We'll have to have you back in a year and learn more about what you've learned in the interim. Those are great resources. Thank you so much again, Dr. Shebani Sethi, for joining us this morning.
Thank you for having me.
Yeah.
Okay. Well, that was really cool.
I feel like every time we do one of these, you and I look at one another when we're done, we go, wow.
I know. It's so fascinating. What stayed with you, Jim, from that conversation?
Fuels, thinking about fuels, switching fuels, and you need to do that from inside. You can't just cram more of a particular fuel that's not working, like carbohydrates. When people really crave them, it's just not going to switch your fuel the way you need to.
Yeah, that's super interesting. I love seeing you get excited about something, come up with a new metaphor. like a kid in the candy store. Very helpful, your metaphors. I find this concept of that it would actually change the structure of the brain, like that you could actually grow new neurons based on what you eat. Yeah. That's wild. Oh, yeah. I'd love to see a picture of that.
Well, image. When I was training, we were still in the era of, oh no, your brain, you only have a certain number of neurons you were born with, and you don't get to make any new ones, so don't be drinking that alcohol and killing them off, Well, oops, sorry, that was wrong. There are parts of the brain, not all of it, that make brand new baby neurons all the time at a remarkable rate. So lithium is one of the things that makes that rate go up. And now we just learned from Dr. Shebani Sethi that sure enough, a ketogenic diet also makes that rate go up, which is amazing to think that you have a medication like lithium, but a dietary change, and they're doing something very similar, if not identical.
You can do both and be better off as a result. Like you were saying, when we have agency, when there's something that we can do to intervene and take control of our own health, that's healing in itself.
Indeed.
Right?
Absolutely.
Yeah. Physical, emotional, creative, and spiritual. Pecs, flex your pecs. And I think about those as the things that we can do to make a difference in our own health. And yeah, the medication's important, therapy if you need it, definitely support networks. But in addition, we can do these things. So like I'm uber disciplined because I know it's at risk if I don't practice my, good diet, good exercise, good going to bed on time, good light in the morning, and all the other things that I do as well. But for people out there just starting, don't get overwhelmed that you have to do everything. But, you start, what's the next right thing, as I know they say in AA. But now I'm like, I'm sort of habituated to, always get up first thing, do exercise, second thing, do yoga. So I guess the keto diet would fall under physical in terms of what dietary choices do we make.
Right. And so, it may be important to clarify that we're not talking about, hey, everybody should go on a ketogenic diet,
right.
But becoming more mindful about the potential impacts of what we eat as having an influence on how we feel, and that we're learning more and more about that. So we've had other guests on the show talking about timed eating, for example, or a Mediterranean diet, as having enough impact that they're even studying those in a randomized trial head-to-head against one another. So these are, a Mediterranean diet or a timed eating is really within reach. As you say, you work your way up to it, but this is within reach even without an expert like Dr. Sethi trying to help you achieve a ketogenic diet.
Right. Yeah, I do both those timed in the Mediterranean. I've learned over time, it just makes sense to me. It's like, okay, shut the factory down at night, give it a chance to rest, open the factory up in the morning, factory being metabolic factory, right? So at night you can clear out all the waste. And I just feel like it is stabilizing of my mood, not to have like a sugar spike after 10 at night, when you're probably not supposed to have that. And then similarly, like it's just intuitive to me, okay, well, if I'm going to have a sugar spike any time in the day, that's not going to be so great for my mood because then it's going to tank after. So I'm not like uber restricted, but I'm like 80-20 rule, and I have to eat maple syrup because my husband makes maple syrup. We live in the maple tree world. I love my maple syrup.
Yeah, 80-20 rule, as you say, 80-20. Good, got it.
Let's say thanks to our editors, Luke Medalla and Hannah Krantz, who are our editors for this show. They've been amazing. And more to come. See you soon, Jim.
Right, great.
Thanks so much for joining us on BrainTalk, our bipolar spectrum podcast. BrainTalk is a program of BrainStorm, a multi-platform project about the bipolar spectrum, which includes Sara Schley's memoir and a full-length documentary coming in 2025. We aim to save lives, crush stigma, and maximize healing for all people living with bipolar and those who love them. For more information, head to www.brainstormthefilm.com. To call in to a future episode and ask questions, go to brainstormthefilm.com/podcasts.